we use a lot of resources to come up with the most accurate answers for you. In this case, we believe that our resources should be transparent, there should be trust, and there should be timeliness to it. So the resources that we use when making decisions like this comes from CDPH, the CDC, the New England Journal of Medicine, the American Academy of Family Physicians, New York Times, and of course, our medical providers here. So let's start with some frequently asked questions in this next segment. First one is, what is an mRNA vaccine and how does it work? So as you can see here, most vaccines work by injecting a weakened form of the disease into your body, right? A shot in the arm or leg if you're a kid. Your body detects these germs and make antibodies to fight them. And these protective antibodies then stay in your body for a long time or for the rest of your life. An mRNA vaccine works by giving your cells instructions that tell them to make a very special protein called the spike protein that you've heard of. Your body's immune cells respond to the spike protein by making antibodies to fight it. The spike protein instructions in your COVID-19 mRNA vaccine help your body make antibodies to prevent the coronavirus from entering your cells and causing the disease. This keeps you from getting sick or even symptomatic. The instructions from the mRNA vaccine do not interact with your DNA in any way. And of course, once the instructions are copied, your body quickly breaks down the mRNA and removes it from your system. So, which vaccines are available right now? Currently, we have 2 vaccines that have been authorized by the FDA for emergency use in the US. The Pfizer vaccine, which is for 16 and older, and the Moderna vaccine, which is 18 and older. In clinical trials, this is the great thing here, both vaccines prove to be greater than 94% effective in preventing people from getting sick with the coronavirus across age, gender, race, and ethnicity demographics. Over 70,000 people were included in the trials of these 2 vaccines. The other question is, which vaccine should I get? In this case, whichever vaccine is available to you right now. We talk about the Pfizer and the Moderna vaccines. There are 3 more vaccines, part of Operation Warp Speed, that should have more data in the coming months. Johnson & Johnson, which is looking like it's going to be 85% effective, and it's planning to apply for FDA approval this month. AstraZeneca, which is about 90% effective, which has already been approved by the UK for use, and Novavax, which is about 90%, and will probably apply for FDA approval use sometimes in April. With the more contagious variants being more present in the US, we want to get vaccinated ASAP to protect ourselves. How long will it take for the vaccine to work? The Pfizer vaccine, which is a 2-dose series, 21 days apart, protection starts about 10 days after the first dose, about 52% protective, and it jumps to 95% effective 1 week after the second shot. For the Moderna vaccine, it's a 2-shot series, 28 days apart, and it went from 80% protective after the first shot to 94% after the second shot. So that's why after you get your first shot, make sure you come back and get your second shot in a timely manner. The other question is, will it hurt? What are the side effects? Both the Moderna and the Pfizer vaccines are reactogenic vaccines, meaning common side effects include pain at the injection site, fever, fatigue, headache, and muscle ache. Signs that the vaccine is working. The injection into your arm won't feel any different than any other vaccines you've received. The side effects, which can resemble symptoms of COVID-19, last about a day and appear more likely after the second shot. Remember, while these experiences aren't pleasant, they are a good sign that your immune system is mounting a potent response to the virus that will provide long-lasting immunity. My own experiences, me after the first shot and after the second shot, I got sore arm that appeared 12 hours after the first shot and lasted about a day. It felt like somebody punched me there. But hey, I'd rather get the punch arm than COVID-19. The sore arm lasted a little bit longer after my second shot, but I also recovered pretty quickly. Everyone's reaction to the vaccine is different, but it's showing that our immune system is reacting appropriately to the vaccine. The other question is, if I had COVID-19 already, do I still need the vaccine? Yes. We know that natural immunity from getting the infection to COVID-19 decreases over time. It's likely that the vaccine will boost your immune system and keep you protected longer. The other question is, if I've been vaccinated, will I still need to wear a mask? Yes, but not for long, right? We know still, after you get your vaccine, still continue to practice all of our safety precautions for now. Once we get more guidance from CDC and CDPH, we will loosen up some of our precautions for staff that have been vaccinated. So not forever. The importance of other safety precautions that we've been doing: mask wearing, physical distancing, hand washing, and avoiding congregating, especially indoor. Why do we continue to do that? It's because what we've learned so far is people are getting infected outside of work in their social situation when they let their guards down. And it's because greater than 50% of COVID-19 infections are spread by asymptomatic people, meaning people who don't have symptoms. So what can we do in our daily life? Continue doing this. Avoiding the 3 C's that we've been preaching from the beginning. Avoid closed spaces with poor ventilation, avoid crowded places, and avoid close contact settings. Another question people ask is, what about transmission by kids? Younger kids are less contagious than adults. They are about 50% less contagious than adults. One theory is that kids have less receptors that the coronavirus bind to in order to infect the human cells. This is why there's a big effort right now to reopen our schools for in-person learning. And how do we make our schools safe? Mask mandate, physical distancing, good ventilation, meaning having classes outside as much as possible, hand washing, having pod arrangement. In this case, the kindergarten class should stay in the kindergarten class. They don't intermingle with the first graders or the second graders. This will be good for pod arrangement or cohort arrangement. And it's also good for contact tracing once we know if there's a positive case. And the other 2 things is more testing, just like what we've been doing with our staff in terms of having surveillance testing. We're hoping to have more testing available for our schools and, of course, vaccinating, which as of last week, a lot of our teachers and childcare providers have been contacted by public health to get their shots already. Another example to remind folks is that why transmission by kids are lower than adults is our childcare partner. They have remained open this whole time in order to help our staff with the childcare services. They have 30 staff, over 100 students, and they have 4 sites. In the 10 months that they've been operational, they've had only 6 cases, and a majority of those cases were outside of the childcare facility. With Open Door, we have over 700 staff, 12 sites, and up to this point, 3% of our staff have come down with COVID. So it shows that if we do appropriate safety precaution, it does work. The other thing to keep in mind too, people are asking a lot about this new variant, the B117 and then the B1351. Keep in mind, the reason why I'm using its nomenclature name instead of the country where it originates from is we do not want to start naming blames or say, oh, this virus came from this country. And so that's why we're using the scientific name, because in the end, it doesn't matter where the virus comes from. It matters that it affects all of us. So with these 2 very, very contagious variants, they are about 50% more contagious than the original strain. The good news is it is covered by the vaccines. And so vaccinate and practice all the other precautions, which should, if we do the vaccination and we continue to do all of our safety precautions, we can still keep these more contagious variants at bay. I will stop here right now just to make sure that I am addressing some of the questions. And at the same time, some other questions that people have been asking is, Should I mix the vaccine? No. And especially our providers and our staff who are educating our patients, if you start with the Moderna, you should get the Moderna as a second shot. Do not mix Moderna and Pfizer. What is herd immunity? Herd immunity is when you have enough of the population to be vaccinated, where it's finally safe to do things again. Right now, Dr. Fauci is predicting at least 75 to 80% of the population to be vaccinated or have been infected in order for us to achieve herd immunity. What about pregnancy? What about if I'm pregnant? Should I get the vaccine? Pregnant patients were not enrolled in the vaccine trial, so there's limited data on the safety. However, the CDC and ACOG, which stands for the American College of Obstetricians and Gynecologists, advise that pregnant women should be offered the vaccine. And Emma Hackett and the rest of our OB team have finalized that instruction. And then we are going to share that with a lot of our pregnant patients, that we will offer that to you. And if you need to, we will have an individualized conversation that is specific to your needs. The other question is, will it work on older people? Yes, clinical trial shows there is no difference in efficacy and safety by age, gender, race, and ethnicity. Very, very good news. Are there any contraindications for the vaccine if you develop hypersensitivity to the vaccine components? I want to put something in perspective for folks. So far, we have received 25 million Americans have received the vaccine. The CDC tracks severe allergic reaction. Of the 25 million people who received the vaccines, less than 100 people, that's less than 100 people out of 25 million have reported severe allergic reaction. What about patients who are immunocompromised? Should they receive the vaccine? Yes, since immunocompromised patients have an increased risk for severe COVID-19 complications. What is this I hear about risk budget? What's a risk budget? Well, during the pandemic, think of yourself as having a risk budget, meaning if you spend some of the limited supply by engaging in riskier behaviors, you will need to cut back in other aspects of your life. And of course, having the vaccines can help expand your risk budget, but they do not make your budget infinite. So for example, if you choose to travel to see your friends, you might want to offset that decision by avoiding indoor restaurants. For me, for example, how I do my risk budget is I have not seen my friends at all since like a year now, since COVID happened. The reason is my risk budget is I don't need to see my friends in person. I can see through Zoom. I can talk to them on the telephone. My risk budget is having my 2 young sons attend in-person schooling. That to me is more important than me seeing my friends. This is all a personal decision. So my risk budget is more dependent on my kids' personal interaction at school than it is for me to socialize with my friends. So everybody's decisions are unique. Just keep that in mind. The other question is, so what can I do once I'm vaccinated and when? So what is safer to do once my friends and family members are vaccinated? Well, if you and the people you want to see are all vaccinated, it should be safer to socialize with them, including indoors. What's safer to do once most of the population is vaccinated? Well, goes back to the idea of herd immunity, right? Once herd immunity is achieved, we can probably start moving around more freely. The question is, when is that going to be? Because as of right now, the gold standard is Israel, who have been able to vaccinate 1/3 of their population. The US, we are doing so well. We are basically vaccinating over 1.2 million people a day. So we're catching up to them. So as of 2 days ago, we are about 8% of our population have been vaccinated. In Humboldt County, it's about 10%. In Del Norte, it's about 5% of the population that have been vaccinated. So keep in mind, once again, I will share screen real. Once again, the resources I mentioned earlier that we always rely on during this pandemic would be, of course, CDPH. One of my favorites is the New England Journal of Medicine. If you go there, it actually gives you some frequently asked questions a clinical perspective, you can check the CDC, the American Academy of Family Physician, and of course, the New York Times keeps tracks of all of the vaccines and the death rates and the infection cases as well. So here's some questions that we've gotten from the chat here that I will go over. So where's the best way to get masks? So when you are outside of work, right, you should basically use like the best mask you have. So it could be like multiple layers, or you can get those masks that are sold at Costco, CVS. And if you want to, you can wear that mask, and then as an outside layer, you can put your cloth mask on. The more layers you have, the better protection it is. Another question we have is surveillance testing that we offer to our staff to do a weekly testing. What is the purpose of that? The purpose of that is to offer another layer of protection. Keep in mind, we started this before all of our staff will offer the vaccination. So hopefully once most or all of our staff have been vaccinated, some of these things might no longer be relevant. What is the percentage of our staff that have been vaccinated? 70% so far have been vaccinated from our staff. For people who got their shots at our clinic, do they go back to the same clinic? Yes. So if Joe Smith got his first shot from North Country Clinic, North Country Clinic will reach out to Mr. Smith and make sure that he's scheduled to get his second shot at the same location. And as if you happen to miss, remember with the Pfizer, it's 21 days. With the Moderna, it's 28 days. You want to keep it within that timeline, but if you miss a few days, that's fine. The other thing too, especially with our staff, right? Some folks got their vaccines after the second shot. They get some, very, very sore, more side effects. We usually recommend our staff getting their shot on a Friday or the day before their day off, just so they can have some time to recuperate. But for staff that are unable to work after their vaccine, contact your supervisor. We have certain programs in mind to help cover the PTO that is related to your vaccine receipt if you're unable to work. We want to make sure that we remove barriers for you to be fully vaccinated. So we have certain things that will help you with that. For those who are asking about how do we create a standby list, make sure with the standby list, move on to the next tier. So for example, if here at North Country Clinic, they are able to make that extra shot, the 11th shot out of that Moderna vial, which is only for 10, they have had a list already of, let's just say people are 70 and above with some comorbidities, and they live in Arcata. So they're like, hey, can you be here in 10 minutes? Having a list of like 5 or 6 patients on there would be good, because we do not want to waste any vaccines at all. And the last thing that most people ask is the vaccine. When you talk about efficacy, 94, 95% from the Moderna and Pfizer, what does that mean? What that means is by me getting the vaccine now, the likelihood of me getting symptoms, whether they are mild symptoms to severe symptoms that require hospitalizations, is very, very low, 95%. I can still get the disease, right? But I would be an asymptomatic carrier. And so that is why this vaccine, it is so effective. It is on par in terms of efficacy with like the good ones, like MMR, which is 96, 97% effective. Compare that, I want to put in perspective, compare it to the flu vaccine, which changes every year. And that's why we have to get a new flu vaccine each season. The flu vaccine is usually about 50% effective. So you compare that 50% effective that you get every year versus this great vaccine for COVID-19 right now, which is 94, 95% effective. That is great. And so far too, when they did the studies and the trials for this, 94, 95% effective, meaning even if you started having a mild headache, that to them is a failure. So even if you show any symptom, that is a failure. And out of all of the vaccine trial, only one case out of the 70,000 plus from the vaccine trial, only one has died. And it might not be related to the vaccine. Okay, that person probably just have multiple comorbidities. The last thing I want to bring up to that Bill briefly mentioned earlier is that now we know about it, have the vaccine helping you not get symptoms. What about, can it decrease transmission? So far, the studies, they need more data, but it looks pretty good. As of this morning, AstraZeneca, the other vaccine, when they look back at their trials, it shows that the vaccine reduced transmission, meaning my ability, if I have COVID, to transmit it to people around me, the vaccine reduced it by 2/3. That's 67%. That is huge. And so once we get more data, that's when we know we can loosen up our some of our safety precautions. The bottom line is this: why should I get my vaccine? Well, I'll give you two examples, and I'll hand it off to Bill. Number one is our healthcare worker was vaccinated 3 weeks ago. She was tested on a regular surveillance testing and was positive for COVID-19. By getting the vaccine, it protected her from having any symptoms at all that would have required hospitalization or maybe even death, given her risk factors. Our contact tracing showed that she did not expose any other co-workers due to our mask mandate and our physical distancing policy. So nobody around her needed to be quarantined. A second example, another healthcare worker was vaccinated and she did not test positive for COVID-19 when everyone else in her household did test positive for COVID-19. Bottom line, the vaccine, it's another tool in our toolbox to fight this virus. We should continue to do everything else in the meantime. Protect yourself, protect others, because we want to achieve herd immunity, especially with the more contagious variants popping all over the place. And last thing is, as more and more people getting vaccinated, we are not getting back to normal. There was never normalcy to begin with. What we should be doing is how we are moving forward in 2021 and hopefully